Welcome to The Explainer. Okay, let's dive right into this. Have you ever actually stopped to think about the sheer logistical mountain of managing healthcare for hundreds of millions of people? I mean, when a government rolls out a public health system at that kind of massive scale, the goal is obviously to heal, to protect, and to provide a critical safety net for the absolute most vulnerable among us. But where there is massive scale and massive funding, there is inevitably the potential for massive fraud. Today, we're unpacking how one of the largest public health initiatives in the entire world is actively and aggressively combating those who try to game the system.
Over 3,200. Just let that number sink in for a second. This isn't the number of new patients treated or the number of shiny new rural clinics opened. No, this represents the total number of hospitals recently penalized in a sweeping, totally uncompromising government crackdown. We're talking about over 3,200 medical institutions that were supposed to be safe havens, but were instead caught violating the very rules designed to protect their patients. So how does the system even begin to find and penalize that many bad actors? Section 1. The Ayushman Bharat Promise, a healthcare safety net. At this scale, we are talking about an absolute game changer. It's a healthcare safety net meant to protect millions upon millions of citizens who'd otherwise be literally one single medical emergency away from total financial ruin. AB PMJAY stands for Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which is India's massive national public health insurance fund. Now, what's really interesting here is that a system of this sheer magnitude cannot simply build thousands of its own government hospitals overnight. It just can't. It has to rely on a vast, decentralized network of empaneled public and private hospitals to actually deliver the care. So the whole shebang rests heavily on a foundation of trust between the government, the healthcare providers, and the patients. But that brings us to a rather uncomfortable question. Who exactly polices the hospitals? It's a really fascinating, complex dilemma. The initiative provides the insurance fund to empower vulnerable citizens, right? But when you introduce massive funding into thousands of decentralized, independent facilities, you are inevitably going to encounter some institutions that see an opportunity not to heal, but to cheat. The intent of the scheme is pure, but the reality of administering it, well, that requires a highly skeptical, incredibly watchful eye. Section 2. Exploiting the system. Breach of trust. Because to really understand the cure, we kind of have to look objectively at the disease. What happens when the very institutions we literally trust with our lives decide to break the rules? Here, we're shifting our focus from the optimistic promise of public health to the gritty, investigative reality of healthcare oversight. The core issue stems from the fact that guideline violations directly threaten systemic integrity. And we're not just talking about a few misplaced decimal points on a chart or minor, innocent administrative errors. When hospitals exploit a public health insurance system, they're actively siphoning off critical resources. Every single time a guideline is violated for profit, money is stolen directly from a system designed for a vulnerable citizen who genuinely needed life-saving care. So how exactly does this exploitation happen in the real world? Well, let's look at the actual mechanics of this breach of trust. It usually comes down to a few common types of health insurance violations. First up, billing discrepancies. This basically means charging the government for services, procedures, or medications that were never actually provided to the patient. Crazy, right? Then there's unjustified admissions, admitting people who don't actually need hospital care just to trigger a lucrative insurance payout. And finally, the failure to meet quality of care guidelines, which means cutting dangerous corners on patient safety and treatment standards just to maximize profit margins. It's methodical, and frankly, it's deeply damaging. Section 3. The massive crackdown. Purging bad actors. But here's the thing. A system this massive doesn't just sit back and let itself be drained. The government didn't just issue a polite warning or a little slap on the wrist. They initiated a sweeping, highly coordinated, and decisive response to root out these violations at an entirely unprecedented scale. And this brilliantly illustrates the varying degrees of punishment handed down. 2,000 hospitals were completely de-empaneled. Another 1,200 hospitals have been suspended. Let me be clear, this isn't some random sampling or a minor audit. This is a systematic, aggressive purge of bad actors from the healthcare network. Let's anchor these staggering statistics in official policy. Health Minister J.P. Nadda explicitly confirmed this, stating over 2,000 hospitals de-empaneled, 1,200 suspended. Hearing this directly from the absolute highest levels of healthcare administration really adds immense authority to these enforcement numbers. It confirms that this cleanup isn't just some localized, lower-level bureaucratic effort. It is a highly serious, top-down mandate to restore integrity to the initiative. Now, to really grasp the gravity of this, let's clearly define what these consequences actually mean. De-empanelment is the ultimate penalty. It completely removes a hospital from the AB PMJAY network, permanently severing their ability to treat patients and receive any funds under this scheme. It's a total cutoff. Suspension, on the other hand, temporarily halts their operations within the scheme, pending a rigorous, deep dive review. But make no mistake, both actions represent severe consequences for breaking the public's trust.
Section 4. Protecting the patients. Strict vigilance.
Ultimately, all of these massive numbers, the sprawling audits, the dramatic crackdowns, they aren't just administrative exercises. They are fundamentally about what this ongoing vigilance means for the average citizen walking through those hospital doors, just expecting honest care. Let's compare the two paradigms we're dealing with here. On one side, we have the old reality, a vulnerability to unchecked systemic fraud where bad actors assumed they could just hide in the massive volume of daily claims. On the other side, we have the new standard, strict compliance, massive data-driven audits, and swift, undeniable accountability. So the crucial point is that by heavily penalizing those 3,200 hospitals, the administration is actively replacing an environment of potential exploitation with a new, uncompromising zero-tolerance standard.
Let's move forward and see how this builds into a highly effective, logical enforcement mechanism. It's really quite simple when you break it down. Step 1, establish strict guidelines. Step 2, audit at massive scale. Step 3, enforce swift penalties. This three-step loop acts as a relentless detective force for public health. It proves that you can't just launch a massive health initiative and look away. You have to continuously and actively police it to ensure it actually serves the people it was built for. Which leaves us with this final, truly vital thought. How will this massive show of accountability reshape the future of global healthcare oversight? I mean, if a system managing care for hundreds of millions of people can successfully audit, identify, and aggressively penalize over 3,000 violating hospitals, what does that mean for massive health networks worldwide? Are we finally entering a new era where data transparency and strict oversight simply outsmart systemic fraud? It's a fascinating question, and it proves that protecting a healthcare system is just as absolutely crucial as building it in the first place. Thanks for joining me for this explainer, and stay curious.